holiday season is always a fun time of year. You've got festive music and bright lights, and you get to go shopping, and it's just always a fun time. But for some folks, the stress can be a little overwhelming, and that's what we're going to be talking about today. Joining us now is Dr. Howard Burley. He's the Chief Medical Officer with the Tennessee Department of Mental Health and Substance Abuse Services. We're so glad you're with us.
I'm glad to be here.
You're going to help us through navigate the holiday season.
I hope so.
Because for a lot of people, Dr. Burley, you know, everything that I mentioned is always kind of the excitement of the holidays. But a lot of people struggle with some mental health issues during this time of year too. Can you tell us what some of the top things are that people kind of struggle with, if you will?
Well, I think you mentioned them just a few minutes ago. It's the anxiety and the depression. Those are two common disorders that happen during the holidays. And then you have the reactions to stress. People may have more headaches. A lot of times they have stomach problems. I think a lot of times we forget that stress, depression, and anxiety a lot of times come out in physical symptoms.
That's true, yeah.
And also there's a tendency towards more substance use. Excessive drinking is a common thing that happens during the holidays, especially when people say they're just trying to take a little bit of the edge off. So those are the common things that occur during the holiday season that people are struggling with.
Let's specifically talk about depression, because when you think of all of the cheer and the festive kind of environment that people expose themselves during the holiday season, you would think it would be more uplifting. But people can go through bouts of depression during this time. And if you can tell us maybe why that is.
Well, for a lot of people, it's really a joyous and cheery time. But for other people, it carries a whole different meaning. It's a time where they become withdrawn, isolated, become more prone to feelings of despair. And a lot of times it can be stress related. Other times it can be associated with things that have happened in the past. If you think about it, the holidays typically serve as landmarks for life's events. So if you've lost a loved one, if there has been divorce,
or loss of a job,
any of the other stresses that occur with just daily life, then they become more prominent during the holiday season. So when everybody else is full of joy and cheer, it's a tendency for that person to sort of pull back and go into their own shell when that's going on.
Yeah, they're reflecting on those things that might not have been
They're reflecting on the unhappy times of the year.
Yeah, well, that makes sense. For those of us who are going through this time and you're trying to stick to your calendar and your schedule and your list of things to do, you get wrapped up in it. But obviously, if you are starting to have some of these kind of feelings, what are some symptoms that start coming about that you can recognize and say, you know what, I need to reevaluate things. I need to look at myself and know, because I'm doing this or feeling this way, this might be a symptom of something more.
Well, usually one of the first things that happens when people feel stressed is it impacts their sleep pattern.
Okay, great point.
Then you look around and sometimes you notice that your appetite is also changing. And then you tend to withdraw from other people. You have feelings of sadness that you don't know exactly why they're occurring. You're surrounded all with these people who are planning events, and then once again, that's another stress for those individuals because they already aren't all into the event, and then they're challenged with going to parties, house guests, all the other stresses that come along with the season.
When you notice some of those symptoms in yourself, at what point should you kind of reach out and maybe get a hold of somebody who can help?
I think it depends on the severity. Because it's not unusual to be a little bit down. We talked a little bit before the show started about how these things tend to resolve at the beginning of the year. If you see a pattern that's occurring with them, that this happens every year, and it's becoming more severe, that's a sign that it's probably something that's more clinical than situational. Most times when we're talking about holiday depression, we're talking about stresses that occur associated with the season. When you pull those stresses away, the person's mood starts to improve. But in those cases when it doesn't, it may be a sign of something that's more severe. And then there are some people who are more prone to being just depressed during the winter months. And if you notice that sort of cycle happening every year, then that's an indication that you probably need to reach out and help for some additional help. And then too, if it's associated with one of the life stresses say for example, anniversaries of loved ones, or that there's been a change in your own status. I know in the elderly sometimes where we see people moving from their home into an assisted living situation, it can be a real time of depression because they're more focused on the happier times that they had in their life.
Yeah, and that's why we're talking about it, because as you had mentioned, for a lot of people, it is a seasonal thing. It's a short-term kind of feeling. For those folks out there, though, who are listening to this and they do notice, just as you were talking about, having issues with depression or having thought anxiety or having, not being able to cope with stress as well, you don't avoid the holidays, obviously.
No, you can't go into a show.
But that's true. How can you go about manage, your reacting and your feelings through this time? What are some helpful things maybe that they can do?
Well, I think the first thing you have to do is take good care of yourself. You have to be concerned about proper nutrition, getting your rest, getting a lot of exercise, trying to get out in the sunlight. That does carry a big impact. I think just recently we've seen bright sunshine and dark days, and people tend to be a little happier during those brighter days. So trying to get out and do something different. And if it's been a pattern with you in the past, one of the things you can do is try to change what you're doing this year as opposed to what you've done in the past. You can always try to get involved in more activities, volunteer. You can reach out and, for example, at work and try to be more social with people that you come in contact with on a daily basis. The more that you can kind of get away from yourself, the better it is.
Those are all great points of good information and good advice for folks to sit there and think about that. Dr. Burley, let everyone know too, since you've studied these kind of figures probably over the years, how big of an issue is this for Tennesseans each and every year? Well,
it's hard to pin down exactly just because of the nature of the depression itself. But we do know that probably 8 to 10% of the population has depression, a clinical type of depression.
Okay.
And then we know that this is much more common and much less severe. So it can be anywhere up to maybe 20% of the population may experience it at some point in time during one of these seasons that comes by. So it's a pretty common problem for people to struggle with during the holiday season.
Sure. You'd mentioned also kind of having the winter blues. That's different, though, than what we're talking about in terms of seasonal affective disorder.
Exactly.
But I guess one can accompany the other, yes?
One can accompany the other, and one can superimpose on top of the other. The winter blues, or seasonal affective disorder, is more of a clinical type of depression, and it's more associated with the biochemistry of the body.
Reacting to the elements.
Reacting to the elements. As you get less exposure to sunlight, there's certain chemicals in your body that change in their level, I guess their peaks and their lows. You get more of some and less of others, and these can make you more depressed. And then what happens is that generally in the fall and winter when this happens, the person becomes more depressed, and as we get more into spring and summer, things get back to normal as the sunlight comes out, and it resolves itself.
So we all just hope to have a very good holiday and make it to New Year, right?
We do.
And I guess you would probably agree with this. If you are suffering from something like this, don't be ashamed to tell a friend or a loved one. No. Make sure that you do that, right?
No. I think that's one of the things that we need to get out there, that it is just so common.
Sure.
And that really one of the best ways to get through the holidays is the support of others around you.
Absolutely. All right. Dr. Howard Burley, we really appreciate your time today. Hopefully you have a nice holiday as well.
You too.
All right. Thank you.